This doctor's English is flawless, yet patients feel uneasy around him. The reason why is almost invisible. Imagine a patient, let's call her Sarah. She's in a hospital room, anxious, waiting for results. Her heart is racing. Every footstep in the hallway sounds like it's for her. The clinical smell of the room, the unfamiliar weight of the blanket, it all adds to her sense of dislocation. Her doctor, a brilliant clinician from overseas, walks in. He stands at the foot of the bed, holding a tablet, his eyes scanning the screen more than they meet hers. There's no warmth, no small talk. He's fluent, his grammar is perfect, his vocabulary is extensive. He says, "Good morning. Based on the radiographic evidence and your symptomatic presentation, the diagnosis is cholecystitis." He continues, without a pause. "The indicated treatment protocol is a laparoscopic cholecystectomy. We have scheduled it for tomorrow morning. Do you have any questions?" On paper, this is perfect communication. The information is accurate, concise, and delivered in grammatically correct English. But Sarah doesn't feel informed. She feels overwhelmed. The technical words, cholecystitis, laparoscopic, fly past her. They are precise, yes, but they are not meaningful to her in this moment of fear. The doctor asked for questions, but the real question in her mind is, am I going to be okay? And there seems to be no room to ask it. So she nods, says no questions, not because she understands, but because the conversation feels closed. The speed, the language, the lack of a pause, it all creates a barrier. This interaction is at the heart of a deep misunderstanding about what it means to be fluent in a healthcare setting, because true clinical communication isn't just about transmitting data. It's about building a foundation of trust in a moment of vulnerability. The doctor's fluency was never the problem. The problem was in the delivery, the music behind the words. We could call it the prosody of care. It's the gentle rise in pitch that signals a question, the slight lowering of the voice that conveys seriousness but not alarm. It's the cadence that says, "I have time for you." And then there's the power of the pause. Pausing after delivering a piece of information doesn't signal uncertainty. It signals respect. It creates space for the patient to think, to feel, and to formulate a question. A pause says, "I am here with you. Your reaction matters more than my schedule." This is also where we see the difference in softening language. Instead of, "You must fast after midnight," a softer approach is, "So just to make sure everything goes smoothly tomorrow, we'll ask you not to eat or drink anything after midnight." The "we" makes it collaborative. The explanation provides a reason, not just a command. In healthcare, the patient is in an inherently vulnerable position. The clinician holds all the knowledge and power. Every word, every pause, every gesture can either reinforce that intimidating imbalance or it can level it, creating a space of partnership and safety. So how would a more experienced communicator handle that same situation with Sarah? They would likely enter the room, and the first thing they would do is change the physical dynamic. They would sit down if possible. This simple act moves them from a position of authority looming over the patient to a position of shared humanity at eye level. Then they deliver the news slowly, in simpler terms. "Okay, Sarah, so we've had a look at your scans, and it looks like the pain is being caused by some inflammation in your gallbladder." Using gallbladder isn't about dumbing it down. It's about using the language that lives in the patient's world. It's a sign of respect for their understanding, an effort to meet them where they are. And after that sentence, they would stop. They would wait. They would watch her face, giving her a moment to process before explaining the solution. They might then say, "I know that sounds worrying, but this is something we see very often, and we have a straightforward way to take care of it." This is reassurance. This is safety. The information is the same, but the experience for the patient is completely different. For many international healthcare professionals, this is a gap that formal education rarely addresses. You spend years mastering complex medical terminology and grammar for high-stakes language exams. You become what you could call exam fluent. Exam fluency rewards speed, accuracy, and the use of sophisticated vocabulary. It's an athletic display of language designed to prove your proficiency to a regulator. But real healthcare English, what we might call relational fluency, has a different goal. It often uses simpler language. It prioritizes clarity over complexity. It understands that the distressed human brain cannot easily process complex information. The goal is not to demonstrate your intelligence, but to foster the patient's understanding and comfort. This is why some of the most qualified professionals can struggle when they first enter a native-speaking clinical environment. It's not a failure of their English, it's that they were trained for a different kind of performance. And this gap is also, quietly, a factor in those language exams themselves. Sometimes, IELTS, PTE, or NCLEX candidates are surprised by their speaking scores, even with perfect grammar. It's because examiners are also listening for this. They are simulating a real-world scenario and asking themselves, would I feel safe with this person? Do they sound like they are listening? Do they sound like they care? That is the invisible component of your score. Ultimately, the language of healthcare isn't about sounding impressive or academic. The tools of trust are not found in grammar books. They are found in the intentional pause, the gentle question, the simple human-to-human language that says, I see you. It's about making another human being in a moment of profound uncertainty feel that they are seen, that they are heard, and that they are safe. Learning to wield these tools is what transforms a fluent speaker into a trusted clinician. It's the most important clinical skill that is rarely ever taught in a textbook. This channel exists to help healthcare professionals speak the kind of English that patients trust.